Tonight, the state has wrapped up its first select hearing on monkeypox. As CBS 8 political reporter Morgan Reiner tells us, the senators heard from a panel of public health professionals and a person who tested positive.
Between everyone who spoke in the room today, they came up with at least a dozen recommendations for the state and the federal government to take in order to address this monkeypox outbreak. One of them is giving full approval to a medication they say already exists to treat those who are exhibiting monkeypox symptoms. But they say because there is so much red tape right now, it takes a doctor hours before they can maybe prescribe it.
Committee on monkeypox will come to order in 60 seconds.
Speaker after speaker at Tuesday's first select committee on monkeypox drew the same parallel.
As someone who entered public service as the HIV crisis began in the early 1980s.
Thank God that monkeypox is not deadly like HIV, but people are suffering.
Each one saying California can do better.
I cannot believe it's 2022 and under a Joe Biden administration, this is still something that we have to rally for.
Jack Hebb is Castro proud.
The gayest neighborhood of San Francisco.
He traveled to the Capitol to give public comment, hoping to fight for his community where he says everyone knows someone who has it.
I ended up in the ER 3 times over the course of 4.5 days.
David Watson knows the pain firsthand. He ran into a friend on the street, gave him a kiss on the cheek, only to find out there was a monkeypox lesion mistaken as an ingrown hair.
Didn't matter whether I was sitting, standing, or lying down, the pain was off the charts.
There are 300 to 400,000 people in California, the state epidemiologist said, are at risk of becoming like Watson.
We need more testing. We know right now the only test that the FDA has approved is swabbing the lesions from monkeypox. So if someone doesn't have lesions, or if the test is done incorrectly, their test may be falsely negative.
Senator Scott Wiener, the leader of the committee, ran through a list of steps that need to be taken.
You might have to isolate for 3 or 4 weeks if you get monkeypox. And for people who can't work from home, they need to have paid sick leave.
The state public health epidemiologists also said they're exploring telehealth options because right now all patients are required to get screened, and they said if you're lucky enough to get that medication, well, then it turns into several different times that you have to get screened.